Hello. Hi, everyone. Do we want to close the door? Okay. Thank you so much for joining us for this session. We're going to begin shortly. I'm Anastasia. I'm a senior writer at Fierce Healthcare, and I'm really excited to be moderating this session. Before we get started, we are going to go down the line here and do intros and talk about your background and how you got into the mental health space. And just as a reminder for everyone, we won't be doing the QR codes to ask questions at the end. We will be taking Q&A, but please just line up at the microphone. It's going to make it much more streamlined and easy for me to take questions. So just keep that in mind. We'll try to leave 5 to 10 minutes towards the end for Q&A. Thanks so much. Christian, would like.
Thanks a lot. Appreciate it. Hello, everyone. Thanks for having us here today. Really a pleasure. I'm Christian Runta. I'm the CEO and co-founder of Merrill Health. And Merrill Health, we are a mind and body approach, a lifestyle medicine approach to treating mental health disorders with a lot of tech enablement. So that's kind of what I'm working on and what I'm building at the moment. And where I kind of personally came from is that I founded Merrill Health. I've been in healthcare for quite a while, 15, 16 years as an entrepreneur, building different companies and technologies. And I used to be in diabetes, in medical devices, and in digital health and diabetes. And came to mental health care, unfortunately, because of losing my oldest brother, Peter, to suicide. And then really wanted to go into mental health care after selling my last company. So very much on a mission here to help people who struggle with mental health problems.
Good morning, everybody. How's everyone doing? Awesome. My name is Devika Bhushan. I am a pediatrician and public health practitioner. I am Chief Medical Officer at Daybreak Health, where we provide services at no cost to youth and families linked through schools and health system partnerships. My journey has been, I'll get into it during the panel, but I also live openly with bipolar disorder, and I first had the opportunity to share that journey publicly when I was serving as Acting Surgeon General of California a couple of years ago. And in that role had been instrumental in putting together the ACEs Aware initiative, which is focused on healing from childhood trauma. And it felt very relevant at that juncture, and especially what we were all collectively living through with COVID, to help do my part to destigmatize living with mental illness and serious mental illness in particular. We'll talk more as the session goes on, but that's me.
Awesome. Hi guys, my name is Ashley Potts. I'm a Vice President of Operations at Wayspring. Wayspring is a value-based care company that is focused on treating individuals who are Medicaid recipients and have a diagnosis of substance use disorder and connecting them to quality care. I come to this panel as an individual who is in recovery from injection drug use. I've been in recovery for 18 years, and we'll get into it further as we go on through the panel, but just calling out that when I was 20 years old, I was homeless, facing state prison, a Medicaid recipient, and basically everyone around me didn't think that I was going to make it. So I've dedicated my entire career into transforming healthcare and advocating for vulnerable populations.
Hi, everyone. I'm Sam Nordberg. I'm the chair of psychiatry and behavioral health at Reliant Medical Group and Atrius Health, which together we have about 1.1 million primary care patients in Massachusetts, and I run behavioral health for both organizations. We have a very large integrated behavioral health program, as well as a lot of sort of centers for excellence around specialty care. And my first career was actually on Wall Street, and my journey into lived experience with mental health was in the World Trade Center on 9/11/2001, where I had a very life-changing experience. And then during my sort of attempts to recover from that, working as an EMT in Brooklyn, I started to get really upset about the difference in the care that I was able to get because of my privilege and relative wealth versus the schizophrenic, sort of homeless people that we were picking up on the streets who had no follow-on care, and we ended up taking to the hospital. And I got really, really pissed off. Went back to school for undergrad in psych and then all the way through to get my PhD. And that anger has sort of been driving me ever since as I look at how we can fix, sort of the many, many problems that we have in our systems of care.
Wonderful. Thank you all so much for sharing. And we are going to talk about how lived experience enables superpowers and a true understanding of unique spaces. But first, I wanted to ask, when it comes to decision-making power and who has a seat at the table in the behavioral health space, to date, or as you were getting into the industry, did it feel like folks with lived experience had a seat at that table? Did they have a voice?
You want to start down here?
Sure.
No.
A resounding no.
I think the real challenge is that a lot of those tables are for people who are naturally more extroverted, they're more capable of speaking up and speaking eloquently in the moment, and that there are so many different styles of engagement that really struggle with that. And so, for me, as somebody who still lives with, very well managed generalized anxiety disorder, panic disorder, those tables are intimidating. And being up here and speaking is intimidating, right? And so it requires management. And I'm lucky enough to sort of have those skills. But a lot of people who don't have those skills are the exact voices we should be reaching, but we don't build systems to reach those voices. We build systems for the people who are comfortable and confident coming to the table.
Yeah, absolutely. And I'll just go ahead and echo a little bit on that. I agree. The answer was no years ago. I spent 12 years of my life as a convicted felon, and I couldn't even get past a job application to get a job because of the decisions I made whenever I was in active addiction. So whenever I think of how the industry is transforming today versus what it was years ago, like, it's amazing. I have a job and I'm in leadership and I have a seat at the table because that was not always the case.
And these conversations that we're having today openly, where people can sit up here and in this community and say, hey, I have lived experience, and my lived experience vitally shapes my lens as I'm thinking about programmatic change, as I'm thinking about policy change, as I'm thinking about which cultural levers we need to pull in which direction to really help to normalize and destigmatize and bring access to more people. I will say, I think classically, clinically, focus has really been around decreasing symptoms and eliminating symptoms, right? But increasingly, as people with lived experience have seats at the table, as we're defining what it means to live well with a mental health condition, that is evolving to really become not just about getting rid of symptoms that are troublesome, but really about how do you embrace a life that is really fulfilling, right? Where you can feel that you're thriving in every single domain of your choosing. And that's a very different set of goals and perspectives that has classically been missing from, let's say, psychiatry and other clinical domains of treating mental health conditions.
Yeah, personally for me, when I came into the field, I used to be in physical health and diabetes, so I kind of came as kind of a super naive person into mental health care. And that's kind of like a gift, to be honest, for me, because I was able to look at things with fresh eyes. And I realized over the years that there's actually a lot of great people with lived experience also making decisions in mental health care. Like, I've gotten to know many people who actually are now making decisions and are in organizations who have this background and have lived experience, but there's also still way too many people who maybe don't fully understand. And I think even that, or even further than that, I think personally, one of the things that I realized when I came in naive to this field was that I think we should challenge some of the fundamentals of mental health care. And we should really think about it. If we have skyrocketing rates of mental illness throughout the world, and yet we are trying to do more and more to combat these issues, but are we really doing the right things? Why are we we're doing more and we're still skyrocketing? So these two graphs should not go in the same direction. They should be going the opposite. So just simple engineering logic, when I, again, being naive with an engineering mindset coming into this field, I started challenging things, and through my brother's unfortunate experience, I really double clicked on in many places to understand what's really working actually in behavioral health. And I realized that unfortunately there aren't many things that are working. Diabetes wasn't great either. We're not good at treating diabetes as a society. Our medical system is mostly good at treating, fixing broken bones, doing surgery. We are really good at that. We can be proud of that as a society. Our medical system really works for that stuff. But anything beyond that, it doesn't really work. If we're really honest, diabetes, we're just managing diabetes mostly. Now there's some reversal happening there's some stuff happening there which is exciting, but in mental health, mental illness, I think we're even further away from actually having solved any of these problems. So I think this is super important work, and it's a great time to be here to do this work. But I think we gotta challenge things And my personal lived experience, luckily, in a way, allowed me to, there's of course, the traumatic things there as well, but like the other side of the coin is a positive thing that allowed me to see things with a new perspective. So grateful for that.
Yeah, thank you so much. And let's talk a bit more about the specifics that your experience allows you to bring to the table. We heard a bit from Devika, for example, about how you can help institute policy or cultural change, maybe destigmatize certain conditions. How do you bring your experience to the table, and what are some of those fundamentals that you're changing?
Oh, we're going to start here again. Okay, let's do it. All right.
We all just keep.
I don't want to be speaking all the time.
Fair enough. The buck stops here. No one else to turn to. Okay. So a couple of things. I thought about this, and given limited time, there are, what I would say is there are so many things. Like lived experience brings to mind a wealth of opportunity because the bar is here. A couple of the ones that I thought would be really important to talk about. One is a system that responds to an individual coming forward with a mental health need should respond in a timely manner that suits that individual, not that suits the system. But our systems aren't built that way. And so, a bunch of the innovation that we've really tried to do at Reliant and Atrius has been around close to real-time response as soon as somebody raises an issue, because that's what I needed. And that's what I was able to afford and buy outside of the system. I didn't have to rely on a system, right? But there are so many people who, I remember, 3.5 years ago, during the heart of the pandemic, we had 3,000 people sitting on a waiting list. And nothing we could do about it because there was nowhere to put them. And so 3.25 years ago, we started an initiative to build out an evidence-based ecosystem for really high-quality digital solutions for our patients, because those are scalable and you can start people in them the next day. And today, for example, we now get patients started on a digital tool the day after they tell us that they have a need. And that kind of timeliness speaks to me in terms of when your life has been turned upside down by the emergence of a mental health problem, which mine certainly was. All my confidence about my ability to do things vanished in the wake of panic attacks and PTSD. When you have that level of urgency and that amount of life change, you can't wait 30 days or 60 days to eventually get on somebody's schedule. You need somebody to tell you, we see you, and we can help today. So that's a big part of innovation that I really use my lived experience to drive toward, is building systems that have much more of a real-time focus on addressing patients' concerns. Stop there.
Yeah, that's a great answer. Putting the patient or the member at the decision of every point in care, right? Because 7 days to someone who is in an active BH crisis or actively using substances is an eternity, right? It's not a realistic time frame. We need to monopolize on the now and on that stage of change. So just, different platforms to raise awareness and generate policy change, from my experience, is making sure that you're doing it at every level and at every facet. So in the communities, speaking of substance use disorder in particular, recovery walks and recovery advocacy movements. We started Recovery Advocacy Day at the state of Pennsylvania that's been going on for a decade, and just bringing individuals with real life stories and talking about, we're not just a news article and a news story that you see. It's not everybody dies. Some people live, and we're here to talk about that, and we're here to talk about that change. And I also think putting that patient and that member at the decision of what every company does, you have to have people within the company that also can view it from that lens, from that lived experience channel. So one of the things that I have always been so grateful that Wayspring does is we've been able to change our policies on a hiring process. So if you have a criminal record, it's not an automatic no, right? I'm a huge advocate of ban the box, right, for obvious reasons. But we're able to look at individuals on an individual level. We were able to do widespread recovery education. What is it like to be a member who's been impacted by the criminal justice system, and bringing individuals of lived experience within the company to talk about that, to talk about those traumas, to talk about the systemic barriers and issues that everybody faces. So we are very much making the decision that puts the patient and that member first, getting real-time access to quality care, but also hiring the people that know how to make those decisions. And I'm not saying you have to know how to operationalize everything, but you have to be able to stand up and say, that happened to me and this is how it made me feel. I don't want anybody else to feel that way. And how do we make that change?
Really powerful examples. Is that? Are we good now? Thank you. I would say pretty much everybody that works at Daybreak, much like many of you in the room and many of the folks that work in this space, have our own lived experience, and that really informs the way in which we design the solutions that we're each designing here together, right? So, for example, if you know what it's like, right, there's usually a gap of years, not months, not weeks, not days, years between the onset of symptoms and the correct diagnosis and treatment plan being put into place. In bipolar 2 disorder, which is what I live with, that gap is on average 11 years. 11 years. And I was lucky to have only 3 elapse between, my first onset of symptoms and that treatment plan being put into place for me. But what that means is that everybody who is working behind the scenes at Daybreak, they bring that same set of, just intimate knowledge of what it feels like to live in the dark, to live with that sense of not knowing what the next day was going to bring, not knowing when your mind would come back to you, not knowing what it would take to get there, to really make sure that we're systematizing a compassionate and efficient process. So for example, much like what Sam shared, we get patients into care in 48 hours of being brought into our system in any way. And that's really important. We also pair clients who are seeking therapy with the right therapist for them 92% of the time. And we all know what it's like when we first show up to see somebody. We put all of our trust in the system. We put our trust in what's going to happen in that encounter, only to be very disappointed if there's not that therapeutic fit, which is the core element that makes therapy successful or not successful. So 92% of the time, we're matching you with someone who looks like you, who speaks your language, who does the work in a way that's going to work for you.
Yeah, really important points. I mean, like one other thing, like I've always been baffled by is like, if we think about like you break a bone, you'll be in a hospital in no time. And who dies of broken bones? Like not a lot. I don't know anyone who's died because of breaking their bones. But then again, like if you're suicidal, you can't get into care, and then we know like how many people die because of that. So I think our system is still messed up even in these kinds of simple ways. And access is really, really important. Then the other thing that I personally learned through my brother's experience was that it's also like, if we think about it, like our healthcare system in general, also outside of mental health, is about episodic care, meaning that we go for visits. And there's a good reason for that. Like, back in the days, you'd visit the doctor, you'd go to a brick and mortar, whatever, or the doctor would come to you even. And that's a good reason for like, why do we do episodic? But today we don't need to be constrained by any of that. Like we have the capability of being present with each other or with other people on an ongoing basis if needed. So what I realized through my brother's experience was that he was getting access to care sometimes. I mean, like there's some visits, like maybe a psychiatrist visit or a therapist visit, and it was like periodic, like maybe next month you'd had a visit. And I mean, like, but what happens in between all the visits? Like he was struggling on Wednesday, and then his next appointment is 2 weeks from now. Like, what do you do then? Like, if he's like super, like, he's really down, he's going through like his worst episode of depression for the next few weeks, and he only has one visit. Like, is that like great? I mean, like, that's why we at Merrill Health, we designed the whole process of care completely from the scratch. And we designed the care to be continuous care, where we do visits, but we also interact with people in between visits. And we are there to support people and also hold them accountable against the care plan that they have, accepted and working with us towards. So anyway, that's kind of another perspective that I think our system is so geared towards episodic, periodic care, but it's like very often with these conditions, it's just not adequate, or it's not the best way to do it. Like, why would we keep on doing that if it's not the best way to do it? Like, I think, again, like, why I want to challenge our current thinking is that, like, there's better ways and better technologies available today that can transform care to make it much more, humane going forward.
Yeah, I love hearing about all these innovative models, and I'd love to hear a bit about the superpower that you feel you have, maybe even outside of the professional setting, in your personal lives, just how you really harness what you've been through and your experience and expertise to live your life. Anyone can kick us off. Doesn't have to be Sam.
We need to start over here again. So what's going to happen?
Go for it.
I run a group. I've been running the same group with the same, curricula updated, for research over the last 12 years, which is basically like, I call it anxiety skills, managing the double-edged sword, right? Anxiety is something that when you have too much of it can feel overwhelming and crippling, but the right amount feels crisp and smart and good, and it can, properly harnessed and managed. I generally believe it can make me better at what I do. And what I do is I create, right? I try to think outside of boxes and apply different lenses, and my anxiety sort of drives me constantly to be thinking about other angles, other ways of approaching something, what haven't we thought of, and that sort of like restlessness for me feels very much like a superpower when I am not overwhelmed by it. And so there is definitely a fine balance. And as I get ready to come to something like behavioral health tech, I'm in a great place right now, but I'm constantly like, am I going to be in a great place, or will I have drunk too many cups of coffee in the morning and not gotten enough sleep, and I won't be in a good place? And that's constantly on my mind, right? So I'm constantly thinking about how I manage my anxiety, but when well managed, I think it's the best. I think it's a super edge. I think it's super helpful.
Great answer. Yeah, talking about transferable skills, I would say one of the biggest superpowers I have is remaining calm in crisis situations, right? So one can say that my life formed me to be that way, but the way I'm able to utilize that is if there's a crisis and other individuals are escalated or experiencing various symptoms, I'm able to really kind of stay cool, calm, and collected and kind of parse through those emotions and kind of navigate that complexity and that conversation. And this even works in like the workspace, right? Like I don't necessarily get fear of like going in front of certain situations or certain scenarios, because I'm just able to be like, well, it's not the worst day of my life, so it's going to be fine. So I'm able to kind of harness all of those experiences that I've had, and I just stay pretty calm regardless of what's happening around me.
I'm going to borrow a metaphor from my friend, Dr. Kimia Saraf. And that is, do folks know what kintsugi is? Have folks heard of that before? Some folks have. So essentially what it is it's a Japanese practice whereby if a piece of pottery cracks or breaks, let's say even into 20 different pieces, instead of throwing that out, they will get it back together again using gold dust mixed with glue, okay? So what you're left with at the end of it is this beautiful, completely unique, much stronger than it was before vessel that you can use again and again and again. And to me, that's what a mental health journey does to a person. You are never the same after as you were before, and it is a constant work in progress in terms of managing and understanding what it takes to stick together and stay together. But I would say that that vessel, just as it's stronger after the fact than it was before it broke, knowing what it takes first of all, to shatter into pieces and then build yourself back together again, and what it takes to stay well through the ups and the downs of your life is something that makes you much, much more resilient, much stronger, and much more capable in the face of newer challenges as you go forward. And I think it also, that whole experience of the shattering and just having to come back from the very worst day of your life or period of your life makes you a much deeper, more empathic human being who can accompany other people through their walks of different kinds of vulnerability in ways that you would never have been able to do if you hadn't had those experiences.
Love that. That's a powerful piece. Well, like kintsugi, that's such a beautiful metaphor and like way, practice and art. But yeah, for me personally, I think I guess one of my superpowers, is that it's an acquired superpower. It's required a lot of practice. But I started meditating maybe 12 years ago every day, and I've been like, not every day anymore, but like maybe like let's say 70%, 80% of the days I meditate for now like 12 years. And for me, actually, I've gotten some of my best ideas and many of my best ideas like during meditation or after meditation. So it's been kind of a really good thing for me, at least personally, to practice and to be able to like tap into some of the other layers of my mind that actually has some good content sometimes. So that's that's been positive, and again, definitely highly recommend that. It's again something that I guess everyone can learn. It may require persistence, but it's useful.
Great. Well, I'll keep that in mind. I have tried and failed many times to meditate regularly. Ashley, you mentioned that it was important for you to point out to people that this is how I felt when it happened to me, and you talked about what it took to, the fact that you consider criminal record when hiring. Maybe to start with you can talk about what it took to change that mindset and to bring people along in that understanding. Like, what does it take for companies to really value and integrate lived experience? What was the argument that you made?
Yeah, guess we're not starting with you this time.
I know. I don't know how to feel about it.
Yeah, so I am very lucky to be at the company that I am now, because that was, everybody kind of is under the philosophy of putting individuals first and hiring individuals with lived experience, et cetera. But I have navigated these conversations in a variety of different platforms. And, I worked for the same healthcare organization for 5 years, and I worked in the hospital side. And this was whenever I had received a full pardon by the governor of Pennsylvania, which is why I say for 12 years I lived with this scenario. So I was, kicked out of college. Nowhere in Ohio, Pennsylvania, West Virginia would accept me for an internship. Like, there's a lot of different scenarios in which I could tell you guys. One of these scenarios was the hospital that I ended up working at. And I only was able to end up working at that hospital because I did a presentation and I shared my lived experience, and the chief legal counsel just happened to be in there. And they said, yes, we will hire Ashley. Well, within the same healthcare organization, there was also an insurance side. And they offered me a position, and I was able to go over there after a couple years. And I put in my 6-week resignation, and then I said, just kidding, you're a convicted felon. You can't come over. So then I had to go back to my current boss and be like, and have this awful conversation about how I wasn't able to go over there. And they said I had to go through this entire, it was probably a 15-page application to try to seek approval from the state in order to be allowed to work there. And it's like, well, I'm allowed to work here, but I'm not allowed to work here. You're the same company. So it was really starting that platform and opening up that conversation. I'm not very quiet. So really kind of navigating that. And then I was able to start within that organization a employee-led program called Learn. And it was Learn, Educate, Advocate, Recovery, and Network. And it was to talk about these specific things in these specific forums and how to don't just view me by what you see me as on a piece of paper, right? Because so often it's, well, you don't look like a convicted felon, or you don't look like this. And it's like, well, what am I supposed to look like, right? We put these stigmas on individuals. And then whenever I was able to come to Wayspring, I had already received my pardon, but we were able to put together, they were already having conversations about policy change, but put together a committee in which when an individual is going through the hiring process, if we want to make them an offer and they have certain crimes that would warrant being, served up to the committee, myself, the chief legal officer, human resources, we all have a conversation about the ins and outs of that. And then we were also able to, again, provide 3 different criminal justice education forums. And the educational forums weren't necessarily to change policy. We had already done that. It was to educate individuals in the company who might not been as experienced with the criminal justice system or with various addictions, et cetera, of like, this is what we're talking about, this is what it means, this is why we want to work with individuals who are coming out of prisons, and really kind of give that education. And I think it was very eye-opening for a lot of individuals, which kind of feeds that whole recovery center workplace and really kind of starting that movement of, I deserve a seat at the table and so does everybody else.
Oh, now me. Okay. I think it is never, and probably will never be sufficient to generate change because something is the right thing to do. And so I think it is critically important to translate lived experience into pragmatic and practical actions that have resultant return on investment. And this is a huge part of the work that I do, is like, we know what the right things to do are. We know what a lot of the things to do that will appeal to people with particular challenges. We know that we ought to be intervening earlier, faster, and yet we have to build the arguments for these. And this is, interestingly, this is where my first career sort of comes into play, which is I know how to model businesses and I know how to build spreadsheets. And so I do so much of that to convince the organizations that I work in that the right thing is also financially viable. And this is a critical part of the work that we need to do. That we need to do the same thing on the treatment side. We do such a bad job of measuring the work that we do in general, and it hurts us so much. And I know that there's a lot of concern about measuring in therapy and in other places, but we are so hurt by the fact that we cannot transparently show people the value of what we do. And additionally, we can't see where our gaps are in order to fix them and get better at what we do. And this is why in the last 50 years, we haven't improved psychotherapy outcomes in real-world settings at all, right? So as I think about translating lived experience and knowing what people need, we as providers, provider organizations, treaters, we have to up our game in terms of collecting the right information, presenting that information in a way that appeals to chief financial officers and gets dollars approved for programs, or we're going to have more of the same for the next 50 years.
Powerful.
Yeah, +1.
Yeah, well, maybe kind of to your point, Sam. I mean, also like that's kind of like goes to some of the basics that I also like when I came into this field with my experience. I realized that like there's so many fundamental issues, like no measurement, like no data-driven decision making. Like what's going on? Like how can we manage anything we don't measure? Like it's going to be impossible. It's just riffing. It's just going to be winging things. And I realized that that's the norm in therapy and mental health, just winging things. Like what? But I mean, like I've since then learned that yes, there's good reasons for that, but we still should challenge that. Like we just cannot accept that because we did something like 20, 30 years ago, we still need to keep on doing the same thing if it isn't working. And also like one of my favorite topics, I'm not going to go into that now because that's not even the topic of this panel, but like why are our outcomes not improving? Like that's a huge point. Like what? Like we clearly we're not doing something right if we can't improve outcomes in 20 years, 30 years. Like that's a long time. Well, anyway, won't go in there, but I think it's really important again to bring in the lived experience through our experiences in our families, in our own lives. And again, like back to the recruitment and like how do we also like hire people and how do we bring these communities together. At Mero Health, for us, it's been very important, from the beginning to really bring together passionate people who are really passionate about fixing these issues. Because like what's important, what I've learned in my entrepreneurial journey over 3 companies now, is that passion and excitement is what drives change. So we got to find groups of people who are really like, who have the reason, have the motivation, have the passion and excitement to really like dive into these issues head on and fix and kind of figure out things. So that's definitely at the core of also like how we hire, how we bring groups together, how we bring people to our community.
The thing I would add is when we're open about lived experience, and it can feel safe to be open about lived experience, there's a magic that happens in terms of the culture within an organization as well as the platform that is built upon that culture, right? So I'm really lucky to be working at a startup where people lead with that lived experience. People talk to each other about it. People help each other take care of ourselves when we need it as we're going day to day. And I think that the work that we do really benefits from that kind of culture and openness that we can foster.
Great. Thank you all so much. And we are, just a reminder to the audience, you're welcome to come up to the microphone. We're going to start taking questions shortly. But maybe with our last couple of minutes, what advice would you give to someone with lived experience that wants to drive change in mental health, that is passionate and excited? How can they start? Who should they, ally with to try to have a voice?
First, I would say nobody is owed your story, and nobody is owed your entire story, right? And there are ways to be open and own your narrative and own your lived experience that don't require total transparency and total openness. And so what I would say is start with small circles of friends, family, trusted members of your community, and see what level of transparency feels good and right, and doesn't make you feel overbeared or overly vulnerable. And so that's one level of it. In terms of what to do in terms of the networks and the strategy and how to get started, I think have conversations with people working at organizations that you admire, that you want to get behind, and figure out sort of how the work gets done behind the scenes, and sort of what you want to put your might behind.
Yeah, you need to understand who controls the levers of power within the systems that you're trying to change and what they care about. And then you take your passion and you figure out creatively how you can innovate that system. But you have to remember that the way you have to speak to those systems is you have to use their language, right? So you need to get to understand how systems of care operate in order to understand how you can influence them to make change. And so, stay true to your passion, your anger, whatever it is that's driving you, right? I mean, there are so many amazing point solutions being developed now by people with lived experience out there trying to build the right things. And now they're all trying to figure out, how do we plug into these archaic systems, right? And you need to understand those systems. You need to understand the language they speak and the motivations that they have in order to get them to buy in.
Yeah, all great answers. I mean, I agree with what everybody is saying, and it's really just take the first step, and just go ahead and try. I don't think I would be in the position that I'm in today if I didn't get involved in advocacy and sharing my story. So many things have come in my life, and I've met so many amazing people and networking that then allies start to rally together and change starts to happen. I used to speak at high schools, and that's how I met individuals involved that worked in the criminal justice system and understood pardons and all of this stuff. So just opening up to those platforms, I agree, talking to a trusted source, maybe developing some bullet points, and you have to speak a language in which people understand, right? And navigating that path. But so much has come from me just taking that single step. That same company that didn't want to hire me, it was a 40,000 employee company. I ended up being asked by the CEO to speak at one of his own employee meetings after, starting a lot of this change and a lot of these movements. So we never know what's going to happen. And again, I navigate well in crisis situations. So I'm like, worst thing they can say is no, or like, it's not the worst day of my life. So really getting over that fear. Obviously, we're always opening ourselves to various stigma that comes, but stigma is a result of lack of understanding and a lack of education, and often some emotional trauma that maybe someone has experienced. So I really just believe the more that we can all band together and kind of debunk some of that stigma that exists, the more allies we have, then we can take over the world.
Love it. Yeah, for me at least, it's been very much about just going in with your curiosity, and like at least for me, it's always guided me to the next and next venture and next adventure. Like, what do I really get excited about, and where do I also like often like also embracing struggle like as means of learning and growing and finding ways to improve things. So.
It's amazing advice. Thank you so much. There was a question in the audience. Would you mind stepping up to the mic? Yes. Would you like to ask your question? Go ahead.
Thank you. I'm really intrigued. My name is Teresa Chapman. I'm a Chief People Officer for a health care organization. And our mission is health for all. And in my role, my focus is to find ways to point our mission inward. We're starting to see a lot of employees coming forth with ADA requests for situations where they're dealing with extreme anxiety. What can employers do so that we're truly walking alongside and supporting someone to be well and to thrive with a sense of belonging and purpose? Because I really want to understand how to do a best effort where that's concerned.
Oh, I know this one. So, I mean, the amazing thing, the great thing about anxiety is that we actually have some of our absolute best treatments for anxiety. And the trick is to get in as early as is humanly possible, because once anxiety starts to really harden, it becomes much more difficult to challenge avoidance and patterns that we have built up. And so there are a couple of things. I mean, one is the more you can do to create an environment of early identification and psychological safety around opening up, the earlier you're going to be able to start that dialogue with folks around what it is that is going on for them, and then work to get them connected with something. The second thing I would say is there are a ton of really great digital tools for anxiety out there in the world that are highly scalable and that people can start really quickly. And so your frontline intervention actually can be something that's very scalable and digital rather than more traditional psychotherapy. And you can save some of that for folks who maybe don't respond or really don't fit well with those upfront digital tools. But I mean, the great thing about anxiety is that until it's actually had time to sort of harden and become habit, it's really, really, really treatable. So what you really need to do is you could even do screenings, but the key is creating psychological safety around identifying early and then getting people into help as rapidly as possible. Time is of the essence with anxiety.
Any other thoughts about supporting them at work also? Because I can't really screen them because that's kind of crossing over the line, but when they self-identify, just wonder if there's any other comments from the panel.
Yeah, I don't have any specific thoughts towards anxiety in general, but just employees in general. One of the things that we would do with, that we do with our staff is, you know, maybe if you work 60 minutes and that is anxious, maybe work 50 and then take a 10-minute walk, or take 10 minutes, walk away from your computer or whatever that environment is. If it is an overstimulation that is prompting the anxiety, maybe not requiring that employee, if possible, to go to that overstimulating event. So really just understanding within reason what is prompting spikes in that anxiety or spikes in the feeling of uneasiness, and trying to break it into small steps of, you know, work 50 out of the 60 minutes, or don't go to this event, or maybe I'll come with you to this phone call or this meeting just to help so you feel supported. I would kind of look at it from that approach, but.
And I would also say just the fact that you're asking this question means that you're already the kind of employer and colleague that people need in the workplace. It's a really anxiety-provoking thing, actually, to go to your employer and say, "Hi, I need this special thing that nobody else has asked for," speaking from personal experience. And it's really important to empower that person to be in the driver's seat of whatever those accommodations need to be within reason, within the scope of what their job still is, but to never put them in a position where they are over-explaining or justifying or having to tell others about the rationale for what it is. So just taking it at face value, putting it into place, and then moving forward and treating them like a colleague.
Leading by example.
Thank you. All of that was awesome. Appreciate you all.
I know we only have a minute left, but please go ahead.
Just real quickly, my name's Shannon. I have a nonprofit organization and thank you all so much for sharing. Have built it kind of out of my lived experience with eating disorder recovery, and that's been my world for 20 years. I feel kind of an expert in it. And then recently, my father died due to addiction, and I'm wanting to kind of expand my nonprofit to serve. And of course, there's a lot of co-occurrence, but scared because that feels like I've really identified with one aspect of my lived experience. But often, there's many aspects of our mental health. It's not so black and white. And so just since we don't have a lot of time, just ways you've kind of found the courage to go into a space where maybe you don't, you're uncomfortable, and also, have some vulnerability emotionally, and make change happen.
Yeah, thank you for sharing that. So talking about different avenues of our own story, my mother died at 56 years old as a direct result of her substance use disorder, right? That's not a part that I tap into well, and it makes me incredibly vulnerable to talk about the relationship between my mother and myself, so I don't do it often. But finding the platform for that, the fact that you're willing to, or even wanting to bring that into your nonprofit, I think is amazing. There's so much to say about individuals who grew up in homes of individuals who are using substances and the trauma, and you mentioned ACE scores, and there's so much to go there. I feel like I only have 15 of the 60 seconds to talk, so I want to let everyone else give their answer.
I'd also just say really quickly that I see a lot of pressure, both internally and externally, for places that have gotten really good at one thing to spread into other things. And I'm not sure that that's always a great idea, because we need those passion-driven, experience-driven point solutions that are really well designed for one thing. And in mental health, there are more than 300 things, right? It's a huge scope of work. And so there's constant pressure to do more for more people. But I also think that there's so much importance in being sharp and crisp and great at doing the one thing. So I would also say, you could also give yourself permission to just stay focused on the mission you've already gotten really good at.
Word.
Great. Well, anything to add? No. Okay. Well, thank you so much to our panelists. This was a fascinating conversation, and thanks to our audience for the questions and for being here.
Thank you.